So I recently had this case where a patient came with massive SAH. Actually, you can see the scan. It looks quite a lot. And surprisingly enough, the patient was well preserved. He was E4, V5, M6, just complaining obviously of headache. So then obviously we went ahead and did CT angio, which showed this tiny little aneurysm arising from the Acom. So the measurement was somewhere around less than 2 millimeter. Now the question is that what do we do with such a small aneurysm? Because one option would be to obviously go ahead with the flow diverter insertion. The problem would be the cost. Not many patients will be able to afford the flow diverter. So then the other interventional option would be to probably try stent assisted coiling. But probably I think that would mean sacrificing the Acom. But the same thing can also be done with surgical clipping as well. That is obviously the clip in this can be applied right across Acom, including the neck of the aneurysm. Because bilateral A1s are relatively of good size, so we could assume that both the sides will take care of each other. But here the problem can be sometimes the posterior part of the Acom will have the hypothalamic perforators, and they are the only supply to that region, and compromising that can be disastrous. So we thought about all these things. I discussed these things with the patient's family. I told that we may not be getting the adequate length of the aneurysm so that the only aneurysm can be clipped. So we may have to go ahead and sacrifice the Acom itself, which may be okay for the patient, but he may also end up having problems if the hypothalamic perforators are compromised. So that was a standby plan. Of course, the first plan was to go ahead and clip the aneurysm if that is possible. So then I went ahead and this is what I found intraoperatively. So you can see that the size is not bad actually. It is not so small. The clip would still hold it, even though rest everything is the same. That is the opposite A1, ipsilateral A1 are all of good caliber. It may be okay to sacrifice Acom as well. But looking at this size, I was happy actually. I think I should attempt clipping it directly than compromising Acom. So I tried it with this 5mm mini clip, and yes, it held it well. So at the end of it, the aneurysm got secured without having to compromise Acom, and hence having the risk of compromising the hypothalamic perforators. At the end of it, obviously it's all good. Patient is doing fine now. Very important thing is that do not go into conclusion looking at the CT angio, especially in terms of the size of the aneurysm, because it may not give you a true picture. One is that the blood clot itself might, sort of push it down a bit to falsely giving the appearance of a smaller size, or it may have gone into a little bit of spasm, especially looking at the amount of blood in this case. So at the end of it, it is worth attempting clipping in even in those cases, because even which I called as the ideal treatment, so-called ideal treatment, that is insertion of a flow diverter for a small aneurysm, the problem would be patient would have to continue taking antiplatelets for a very long time. So now the patient is spared of antiplatelet medication, and clipping is definitely considered as a permanent solution. So definitely, even in these small aneurysms, I think it is worth attempting the clipping.